This is Mike Muldoon. I'm an orthopedic surgeon specializing in hip and knee surgery with Synergy Orthopedics here in San Diego. Now I would like to talk to you about knee replacement surgery. Knee replacement surgery is what is done for what we term as the end stage arthritis, or arthritis that cannot be treated by any other means, such as injections, other types of surgeries to correct abnormal forces around the knees, or arthroscopic surgery to take care of unstable knees or meniscal tears in the knee. For me, a knee replacement is a very common operation. I do 100 of these a year, and I never really felt that a knee replacement was the equivalent of a hip replacement in terms of the relief that patients received with it. It did great, but a lot of people complain about their knee replacements. Now, why would that be? Well, the knee is a very superficial joint, and you're replacing the surfaces with metal and plastic. So there's a sense of a mechanical clicking and catching that's always there that you don't get with a deep ball and socket joint like the hip. Additionally, the knee is tricky to balance because you're dealing with ligaments that are left behind and with different soft tissue balancing that we try to mimic the patient to a certain degree, but we have difficulty getting it just right. The other thing about knee replacements is that patients complain a lot of pain after a knee replacement. Now, the most dramatic change in my entire practice over the last 20 years has really been how I've approached knee replacement surgery, because people like me have been concerned about that we're not delivering the ideal experience for our patients, and that maybe it's a very common operation, but we have too many patients that aren't happy with their outcomes. So one of the things that I felt was really important, and have always felt was important, but I've only more recently had the tools to take care of it, was that knee replacements have a narrow window where the performance is excellent. So if we can eliminate variance in knee replacement, then we're going to get better results and happier patients. And this has been only achievable, in my opinion, on a consistent basis from a certain small percentage of absolutely elite knee surgeons until the advent of computers and robotics to assist us in surgery. So over the last 3 or 4 years, I've evolved my practice to the point that 98% of the knee replacements I do involve the use of robotics and computers to get absolutely precisely balanced knees that are sized as close to ideal as possible, and that respect the soft tissue of the knee and allow us to avoid unnecessary dissection around the knee joint. Now, this doesn't make it a minimally invasive procedure by any stretch of the imagination, but doing a total knee replacement that is navigated and balanced with the use of robotics and computers gets us much closer to that goal of a knee that you can forget once you've healed up from your surgery. If you'd like to learn more about knee replacement surgery and my philosophy about it, please feel free to contact me, and my contact information is listed below. Thank you for your attention.